Hi there, welcome to our group's Powtoon presentation on primary care nursing. Please sit back and enjoy our Powtoon. This is Anne. She works hard as a primary care nurse. So what exactly is a primary care nurse? Primary care nursing is considered the first level of medical care and is usually on a broad and basic spectrum.
This means caring for the same group of people for an extended period of time, rarely dealing with emergencies. What a primary care nurse experiences will depend on their specialty and/or where they work.
There are some specialties that a primary nurse may work in. These include general, which is all ages, pediatric, which is children, and geriatrics, which is elderly patients. So you are probably thinking, what exactly does a primary care nurse do? When you encounter a primary care nurse, he or she may do some of the following: check your vitals, record your height and weight, take samples, or administer medications. They also have duties such as answering the phone, reviewing patient history, and recording signs, symptoms, and concerns. They also schedule appointments, and of course, they are always an advocate for their patients. So where do these type of nurses work? Primary care nurses work in various places, such as physician offices, outpatient clinics, and sometimes nursing homes and hospitals. You say you want to become a primary care nurse, and that's great, but first, there are a few education and testing requirements you must meet. You must obtain a degree in nursing, either a bachelor's in nursing or a simple associate's degree in nursing. Next step is passing the NCLEX so you can practice nursing. Then, continuing education, you can specialize in certain areas. However, you will always continue your education through your nursing career. Thank you for watching our Powtoons presentation. We have had a wonderful opportunity to have a glance into a day of a home-based primary care nurse. Please stay tuned for the next video of what we learned from her.
Created using Powtoon.
We had the opportunity to interview a home-based primary care nurse, and this is what we learned. What is expected of a primary care nurse in a home-based setting?
A primary care nurse in a home should demonstrate leadership in delivery and improving holistic care utilizing collaborative strategies with patients, family members, and significant others, and any others part of the interdisciplinary team.
What is a home-based primary care nurse?
A home-based primary care nurse is a registered nurse responsible for a continuous delivery of primary care in a patient's own home.
What is expected of a primary care nurse in a home setting?
A primary care nurse in a home should demonstrate leadership in delivering and improving holistic care utilizing collaborative strategies with patients, family members, and anyone else involved in care of the patient.
What are some practices displayed by a primary care nurse in a patient's home?
A primary care nurse can administer prescribed therapies using appropriate judgment. They can accurately document in the medical record patient findings, assessment, and the care provided. They apply problem-solving skills on the unit or program level, leading to an improvement in patient care. and they can administer medication and treatments in accordance with established procedures and policy. What ethics should a primary care nurse display working in a home-based setting?
A primary care nurse should practice in a non-judgmental, non-discriminate manner and is sensitive to diversity, and they should also act as a patient advocate when patient self-determination is in question.
How does a primary care nurse perform in a home-based setting?
They should accurately report and record plan of care, nursing care given, and patient's response to interventions, and they should also assess patient care needs, skill level of personnel, and assign responsibilities as appropriate to meet needs.
Created using Powtoon.